There is a new medication on the horizon designed to improve your erection, penile rigidity, and the overall quality of penetration. This is a drug that promises to be significantly better than Tadalafil, better than Viagra, and better than Cialis. Stick with me until the very end, and you will understand everything about this new pharmaceutical emerging on the market called Simenafil. We study a lot about how to improve erections. The truth is, we already have a series of treatments available today that are very effective. So if you are watching this and you are struggling with penetration, if you feel your erection is weaker than it used to be, or if you are losing your erection in the middle of the act, you need to know there are solutions. There are many causes for this, but the treatment path is often very linear and has high success rates. What we have available today already provides a very high rate of success. However, you need to understand the why and the how before you just jump to a new pill. Every man who deals with erectile dysfunction needs to go through a proper screening, and understanding this context is crucial to understanding why this new drug, Simenafil, is such a big deal. When we look at erectile dysfunction, we have to look at the hormonal aspect first. One of the possible causes is a drop in testosterone. Sometimes you might be stuffing yourself with medication, taking Tadalafil, taking Sildenafil, but your root cause is hormonal. If your tank is empty, it doesn't matter how good the engine is. The car won't start. For some men, the solution is hormonal replacement, or stimulating the testicles to produce more testosterone, especially if you are younger and have functioning testicles. So if the cause is hormonal, you screen for it and you treat it. Then we have the vascular causes. This is very common in men as they get older, usually starting around 40, 45, or 50 years old. If you are diabetic, a smoker, or struggle with obesity, this process happens much faster. But here is the hard truth. The simple fact of aging is an inherent factor in the stiffening of your blood vessels. This is called arteriosclerosis. Your vessels become more rigid, and it becomes physically harder for blood to reach the penis and stay there. Your erection gets progressively worse simply because the plumbing isn't as flexible as it was when you were 20. And of course, we cannot ignore the psychogenic causes. This is massive. Performance anxiety makes you nervous. When you are nervous, your body releases adrenaline. Adrenaline is the enemy of an erection. Adrenaline is a vasoconstrictor, meaning it clamps down on your blood vessels and pulls blood away from the extremities, including the penis, to send it to your heart and lungs for a fight or flight response. You cannot have an erection if your body is flooded with adrenaline. These three pillars, hormonal, vascular, and psychogenic, must be evaluated individually. You are an individual, and you deserve to be treated as one, not just given a generic pill you saw on the internet. Now, with that foundation laid, let's talk about this new drug. We are talking about a medication that is currently in Phase 3 clinical trials. For those who don't follow pharmaceutical development, Phase 3 is the final step before a drug is reviewed for commercialization. It means it has passed safety tests and is now being tested on large groups to prove it works better than what we already have or better than a placebo. There was a major study published recently in 2025 that has the medical community buzzing. This was a substantial study involving over 760 men. They were evaluated over a period of 12 weeks. The study was what we call a multi-center, randomized, double-blind, placebo-controlled study. That is the gold standard of scientific research. It means neither the doctors nor the patients knew who was taking the real medication and who was taking a sugar pill. This eliminates bias and gives us data we can actually trust. This study tested Simenafil at doses ranging from 2.5 milligrams up to 20 milligrams. The most common dose used was 5 milligrams. The results were incredibly promising. The men taking the medication showed a robust, vigorous improvement in erection hardness and maintenance compared to the placebo group. We are talking about a statistically significant improvement in the ability to penetrate and maintain that penetration through to completion. One of the key questions everyone asks is about speed. How fast does it work? The study data shows that the onset of action, the time it takes for the drug to kick in, is between 30 minutes and 4 hours. While there isn't a strict recommendation yet on exactly how many minutes before sex you must take it, this window gives a lot of flexibility. It allows for spontaneity, which is something many men feel they lose when they have to treat ED. Currently, there is no recommendation for daily use with Simenafil, like we see with low-dose Tadalafil, Cialis daily, where you take a small pill every day to be ready anytime. That protocol might be developed in the future, but right now, Simenafil is being looked at as a highly potent on-demand medication. And speaking of potency, this is where it gets interesting. The study showed effectiveness starting at just 2.5 milligrams. To give you some context, Tadalafil usually starts at 5 milligrams or 10 milligrams for on-demand use, and Sildenafil, Viagra, usually starts at 25 milligrams or 50 milligrams. The fact that Simenafil is achieving robust erections at such a low milligram dosage suggests it is a very high potency compound. Increasing the dose increases the effect, but the baseline efficiency is already incredibly strong. But the real game changer, and the reason this might make Viagra and Cialis obsolete for many men, is the side effect profile. To understand this, you need to understand how these pills work. Sildenafil, Tadalafil, and now Simenafil belong to a class of drugs called PDE5 inhibitors. PDE5 is an enzyme that breaks down the chemical responsible for relaxing your blood vessels. By blocking this enzyme, the drug allows nitric oxide to build up, your vessels relax, blood rushes in, and you get an erection. That's the goal. However, the human body is messy. We have many different types of phosphodiesterase enzymes, not just type 5. We have PDE6, PDE11, PDE1, and so on. The problem with the older drugs is that they aren't perfectly selective. They are a bit like a shotgun. They hit the target, but they hit things around it too. For example, Sildenafil, Viagra, inhibits PDE5, but it also accidentally inhibits PDE6. PDE6 is found in the retina of your eye. This is why many men who take Viagra report a side effect of blue vision, light sensitivity, or blurred vision. It's directly messing with the enzymes in your eyes. Tadalafil, Cialis, on the other hand, tends to cross-react with PDE11. PDE11 is found in skeletal muscle tissue. This is why a common complaint with Cialis is lower back pain, thigh pain, or general muscle aches that feel like you worked out too hard. This is where Simenafil shines. The chemical structure of Simenafil is designed to be highly selective. It is like a sniper. It targets PDE5 almost exclusively and largely ignores PDE6 and PDE11. Because of this high selectivity, the clinical trials for Simenafil showed that it does not cause the blue vision associated with Viagra, and it does not cause the muscle aches and back pain associated with Cialis. This is a massive improvement for quality of life. Nobody wants to trade an erection for a migraine or back spasms. Now we have to be realistic. It is still a vasodilator. It still opens up blood vessels. That means some side effects are unavoidable because of how the mechanism works. You might still experience some nasal congestion, maybe a mild headache or facial flushing, redness in the face. These are standard with any drug that increases blood flow. But removing the specific annoying side effects like vision changes and muscle pain makes this a superior option for many men who tolerate the older drugs poorly. So, in summary, we are looking at a drug that offers high potency, perhaps higher than what we are used to, at lower doses. It provides robust, rigid erections. It acts relatively quickly within 30 minutes. And most importantly, it does so with a cleaner safety profile, eliminating the visual and muscular side effects that have plagued users of Sildenafil and Tadalafil for decades. I am very optimistic about this. While it is not on the pharmacy shelves just yet, the fact that it is in phase 3 trials with such positive data means it is likely coming in the next few years. Hopefully, it won't take too long to get approved and distributed globally. It's always good to have more tools in the arsenal. We already have oral medications, we have injectables, we have intraurethral gels, and we have penile implants for severe cases. But having a new oral medication that is stronger and cleaner is a win for men's health everywhere. Until Simenafil arrives, there are ways to maximize your current performance. There are combinations of supplements and lifestyle changes that can boost libido and blood flow right now. If you want to know more about optimizing your performance with what is currently available, you should check out the next video where we break down the best options for boosting libido and erection quality naturally.